Good evening and welcome to the McHenry County Board of Health regular meeting for October 20, 2025. I will call the meeting to order at 6:31 p.m. We'll begin the meeting with a roll call, please.
All right. Okay. Pamela Altoff.
Here.
Barbara Ansel.
Here.
Cecilia Carmen.
Here.
Cindy Gaffney. Sarah Hollyfield. Melissa Katz.
Here.
Carrie Lynn Mawson.
Here.
Kristen McGuire. Kyle Markison.
Here.
Guadalupe Ortiz.
Here.
Michael Zurich.
Here.
And Mr. Joe Clark.
Here. Thank you. Item 2 on the agenda is public comment. Is there any here on public comment? I don't see nobody. So we'll move on to item 3, minutes of approval. Minutes from regular meeting September 15th, 2025.
I make a motion to approve the minutes from the September 15th, 2025 meeting, regular meeting. Second.
Okay, motion has been made by Ms. Carmen, second by Dr. Amsler, to approve the minutes from regular board meeting September 15th, 2025. Any discussion? You're seeing none. We can do a voice vote. All those in favor say aye.
Aye.
Opposed say nay. Motion passed. Item 4, department and division updates.
So hopefully I'm not stealing any of Patty's thunder, but we had a very lovely tree dedication ceremony here on Saturday for Jeff Lovato. A lot of his family came, we had staff, and Mr. Clark and Mr. Markison were there. So I just encourage you, when you have time, the tree is out on the east side of this building, and there's a lovely marker at the bottom. I think the family really appreciated it. It was very nice. The weather kind of opened up and broke, and it was a lovely day. In some good news, it's not a huge amount of money, but some of our grants have been restored. So where the state had cut back a little bit, our FEP grant, CRI, and breastfeeding peer counselors. So it's just a little under $50,000 that will come back into our grants, which is nice. Every little bit helps, and we further offset some staffing on those grants, offset the general fund. In other news, the county budget goes on 30-day review tomorrow. So there could be potential changes. If anybody listened to the COW, or I will encourage you to listen to the COW, there's both background slides and information presented by the county chief financial officer to kind of understand where the county is at and hear some of the comments from county board members on their feelings. So the 30-day review, they're going to get input from the public, and then the county will have to make some decisions about whether or not to increase the levy, do a 3% cut, take the look back. These are all things that are out there for consideration. And I don't know, Pam, if you have anything to add on that, but I think it's just next month they will have to vote on that at their November meeting. So more to come on that. And that's all I've got.
Okay. For those that are listening to audio or watching, member Ms. Gaffney and Dr. McGuire has joined the meeting. Director Noem?
Yes, just a couple things. We did this past weekend have our last electronics recycling event at the fairgrounds, and actually it was our biggest event outside of our household hazardous one. We had close to 600 participants, which is great, except when the traffic gets backed up on Country Club, not so great, but other than that, we worked through it. It was well attended. The Woodstock ones are actually usually quite well attended because we partner with the city of Woodstock, and they use their plastic bag fee, those funds, to actually pay for some of the recycling for Woodstock residents. So it's a good partnership. We have completed our mosquito surveillance for West Nile virus for this year. So just a quick overview, we collected about 300 batches of mosquitoes and tested those for West Nile virus. 35 of those batches were positive. That's really pretty much in line with what we've seen in other years. We're very consistent with the weather and the precipitation patterns, which is very typical. And then we do have 2 open positions in environmental health, one for a full-time administrative specialist. She's moving, our current person is moving over into the WIC program in public health nursing, and 1 environmental health practitioner, but we are actually receiving quite a few applications and good applicants, so we're excited to move forward on that. That's all I got.
Thank you. Director Marin?
Thank you. Just a reminder, the Employee Appreciation Week is October 27th through the 31st. The Employee Appreciation Luncheon will be held on Wednesday, October 29th, here at the County Administration Building from 11 to 1 p.m. So we're very excited about that. We have a lot of things planned. The committee has worked very hard on having a week-long celebration of all our employees, so it's going to be great. The Crystal Lake update, just so everybody knows, the IT department will be out for the next 2 days cleaning out the IT closet. When we have gone in there and had reorganized, kind of moved everything around, we are going to need a lot of new cabling, et cetera, et cetera. So IT is going in starting tomorrow and Wednesday all day long, and animal control will be down to a soft close. We already posted it on the website and social media so that people know. We have some of animal control employees coming to admin to work for those 2 days. We have other employees that will be located at animal control, the kennels and all of that. So, and of course the officers will be around. There may be a few hours, an hour or 2 where the phone system may go down, so we do have a backup plan for that as well. They'll switch all the calls over to admin, and we will then kind of dispatch, if you will, from there. So we have that all planned and ready to go. The parking lot is completed, landscaping is completed, looks gorgeous. The windows are in, the walls are up and painted. They're going to be putting all the, sprinkler systems are going in this week on both the east and west end, so that's very exciting. And all the drop ceilings will be put in this week as well. So it really is moving along, and we're very excited about it. So we're hoping in November that you could do a walkthrough, but that would only be on the nursing side because they have not yet started animal control, but we'll be doing so within the next few weeks. So it's humming along.
Question or comments from board members? Okay, thank you. Director Hack?
So just a quick update on the WIC funding, because a lot of you have probably heard what's going on. IDPH did inform us that they will be funding WIC through the end of the month, but from there, it's still up in the air what we're going to do or where the funding is going. The good news is that we did have a meeting last week with the National WIC Association, who kind of supports policy and a little lobbying for WIC, but they, they stated that there's definitely bipartisan support for fully funding the WIC program. So it is in there on both sides as being fully funded. We just need a budget passed to know what's going on. But they do have some options that they're working on to keep it going if the budget doesn't get passed. So more to come on that. As we hear more information, we'll let you know. And then a quick update on the community health assessment. So we did finish all the pieces of the assessment. The survey, the key informant surveys went out. The focus groups were completed. So our vendor that we work with, Metopia, will be putting together a presentation for our funders. So once that's done, should be in the next month. They will put together also a final report, and that I will bring to the board for you to see the results of the full community health assessment. So we're glad that it's almost done. And then probably early next year, we'll do like a big community presentation where we'll invite everyone at MCC again, so everyone can hear the results. That's it for me.
In regards to WIC, this is the first time hearing of any issues. Is this because of the government shutdown?
Yes.
Just so it's directly tied to that. There's no other directives or anything?
No.
Okay.
And our state did have enough in reserves where they could fund the WIC program through the end of this month. So now they're just looking at other options. Like they said, they have some vouchers from formula companies and things that they can work with nationally to try and continue the program a little longer, but it's still up in the air. because of the shutdown.
Will you let us know if there's anything that we can do as community members or board members or humans, if there's like a supply drive, like what might be needed at some point so we can make sure to help support?
Sure. And the tough thing about WIC is if the money's not coming from the USDA, we don't have any benefits to issue the mothers, but it will be tough because a lot of them do rely on our, for formula or special formula that they just can't afford, so, and not just the breastfeeding and those kind of.
Well, and I think that's where I feel like maybe we could help, like,
Okay. If we get to a
Donate
point where we
formula or-
are struggling, we'll let you know. Thank you.
Do we
Maybe
have an
before we're
estimate of the
struggling.
number of families that would be impacted?
Well, right now we have 2,000 some.
82, I
Yeah,
think.
Yes, I think
you
Melissa
just
knows
quoted
exactly.
that.
Yeah,
Family or participants on WIC,
Okay,
so.
so significant.
It's like
Yeah.
2,082
Yeah, per month.
babies and.
Children under 5 and under.
Any further questions from board members?
In addition to WIC, broad brush, your other things that are being affected by us funding wise from the shutdown?
No, and as Melissa mentioned, surprisingly, 2 of our grants that were cut were restored the funding, so,
Those are federal.
yeah.
yeah.
Oh.
Mhm. And they were emergency, like for me, it was emergency response grants, both of them
Uh-huh.
got cut, and then now they just released an amendment to give us the dollars back, so.
Those are-
Do
But I
they come
think-
through the state? Or do they
Yes,
come
yeah,
direct?
they're
no,
filtered through, I
no,
don't
they
have
come
to-
through the state. They're passed through.
Mm.
Obviously, I don't have a crystal ball, but I think 2027 is gonna has the potential to look different, and we'll just have to see what that looks like.
26 or 27?
27.
That's in a long time.
Well, not really.
No, it's tomorrow.
Yeah, I feel like it's, yeah, it could be
It'll happen in a
tomorrow.
heartbeat.
Yeah. So we'll just update you as we have more information, but that's the big grant that is currently impacted as a result of the shutdown, but they actually gave us more money this year
Mhm.
than in the prior year.
How many dollars?
WIC?
Just guess.
Eight something, none?
No, I think it's 700
Million?
something, isn't it?
I'm just kidding.
It's our largest grant.
Yeah. Almost 800,000.
Yeah, 800,000, okay.
And we did get a
Gotcha.
lot more. But they also, because how WIC determines how much we get is based on our our caseload.
Mhm.
So because our expected caseload went up, then the funding went up.
If there's a short funding here and we get to a really awful time, maybe in a month or two, and people there's nothing to give from this program, would we anticipate to see the case numbers drop and therefore next year might be hard to get people to come back to the program?
Well, it would be universal. So
Right.
whatever, I think the government, I don't know the answer to this, but, sorry Megan, I
No,
totally
go
just
ahead.
cut you off, but I would think they would have to come up with a solution and not have that impact, right? At no fault of the local health departments or whoever is operating WIC, right? That caseload drop would be due, I think, directly related to the shutdown.
Right.
Yeah.
What
And
I'm
I
getting
guess-
at is I worry that it will drive, I'm sorry, I know you were going to respond there. What I'm being direct about is I worry that it will drive, the lack of the service will then therefore cripple the service, will then reduce the interest in that service, which will then cause, untold additional suffering. And then we'll have to actually put effort into luring people, not luring, but like advertising the program. Like I know what happens. Women
Building trust.
and children who don't get this care, I've seen homeless on the streets who don't take advantage of it, and they suffer from malnutrition and long-term calamity. And that just seems unfortunate that in addition to the lack of the funding and the obvious detriment to the people, is that then we'll actually have to put extra effort in to basically coax people back to the program for their own good. I don't know, that's what I worry about. Or do you think we'll just turn the spigot back on and they'll be like,
I think the need's always there.
Yeah, I do.
And I think that it's a close enough community that once the word gets out, it'll get out to a broader group of people. I mean, don't
Cool.
you? I mean, yeah. I
All right,
mean, there's a
thank you.
network.
That makes me feel better.
There's some pretty needy people.
I've been seeing some time travel shows recently, and time is messing with my brain.
I think that the most important
2027 's
takeaway.
tomorrow.
I know, try to do something.
It is. basic and have, well, you start budgeting
Yeah.
early for that stuff,
Director
sorry.
Hack, you were
but-
gonna say, I'm
Oh,
sorry.
I
When
was
you're
just
old,
gonna
it
say, I
happens
think the
real-
shining light is that, it's, there's bipartisan support for fully funding WIC, so that's good.
It's true.
Nobody's trying to cut it, it's just they have to have a budget passed.
It's just what?
Ruby.
We have to pass a budget.
Yeah,
Oh.
but both sides agree it needs to be fully funded. So that's not an issue, it's just,
Yeah. Which makes it a little bit easier.
How long would it take to pass it?
Okay.
3-4 days?
A lot of stress,
Is it
Thank you.
possible to
Director Durrett?
borrow funds from another
Oh, sorry.
area
well, I think the
until
issue,
they figure out what they're gonna do?
yeah, I don't know what they're gonna do. I'm not even sure nationally what the budget is for WIC. Yeah, but I'm not sure. We are pretty lucky that our state does have that reserve funding, that they can keep the program going, because there are some states who have had to stop it. And so they're really struggling.
Go Illinois.
Director Durrett?
Sure. October is Breast Cancer Awareness Month, as many of you might know, and so our IBCCP team has been busy. Last Wednesday, they hosted the McHenry County Women's Cancer Task Force meeting. That's a meeting that they do quarterly. Then National Mammography Day was the 17th, and we put out some social media post about awareness. 1 in 8 women will get breast cancer in their lifetime. One of the kind of alarming stats. So we're working on promoting screening this month especially. IBCCP had a presence at the 25th annual Care for Breast Cancer 5K, which was at Woodstock North this weekend. They were out there with the mobile clinic and had a presence. They've been at that event for many years. IBCCP had their audit. They had 1 corrective action finding for their clinical side, but 0 fiscal findings, which was the first time that the man who does the fiscal side of things has ever had that happen for any county in 3 years. So that's as long as he's been in that role, which I think really says something about how we are doing here at the county. And I'm not sure, we had significant staffing changes in that program, so we are extraordinarily proud of the team and all of the hard work and time that they put into that program, both in stabilizing it, continuing it, and being there for the women in the community. So big kudos to the IBCCP team. As far as the respiratory season, general respiratory illnesses are at the moderate level. It's a normal range for this time of year. I don't have anything additional to add to that. That's it.
Questions or comments from the board members? Thank you. Manager Carlson.
We finished our last low-cost vaccination clinic a couple weeks ago. Just over 250 animals served. Unfortunately, we had several no-shows, but that's bound to happen. We did have 2 new employees start last week. One of our volunteers moved into one of our office positions. She enjoyed being in our facility, so that was kind of nice. And then our kennel coordinator position was filled. Kelsey has a background as a veterinary technician and in behavioral sciences with the animals, which is what we were looking for. So that was also nice. Other than that, Ann already touched on the construction and the shutdown. No, that's okay. She stole the shutdown thunder, but other than that. And then this month, we're running a low-cost special for cats and kittens, if anyone is interested. Or if you know people who want cats.
Very good, thank you. Any questions, comments?
Could you ask, I mean, there was a period of time where it was difficult to find people who wanted to work for the animal department, McHenry County in general. Could you ask what all of a sudden made it, I mean, the one I understand, she's familiar, right? She's been a volunteer. But to get quality individuals, I'm just curious as to what drew them in.
Okay, yeah, I can look
Yeah,
at that.
ask. It's new play, I'd be real curious. I'd like to use that info.
Well, I think some of it, Mary Ellen has touched on this before. I think when we did some work with county HR and some of the salaries went up, that certainly
Mhm.
helped.
But I would like confirmation of that, if that is an incentive, because I'd like to take that back to administrative services if that in fact is exactly what happened. That'd be nice. Thanks.
Anybody else? Okay, thank you. Dr. Tomaso? Anything? Nothing, very good. Next item on the agenda is the consent agenda. Dr. Amsler,
Pardon?
the consent agenda.
Consent agenda. Yes, I will move to accept the consent agenda.
A second?
I'll second.
A motion has been made by Dr. Amsler, second by Mr. Markison to approve the consent agenda. I'm sorry, I forgot to ask, does anybody want anything removed from the consent agenda? Good, thank you. Any questions, comments from the board members? No? As is a monetary topic, we will do a roll call vote, please. Dr. Amsler and Mr.
Yes.
Markison.
Dr. Amsler and Mr. Markinson.
They're the first two.
Oh, I'm sorry.
Okay.
Okay, Dr. Amsler,
Yes.
Carl Markinson,
Yes.
Caroline Lawson,
Yes.
Dr. McGuire,
Yes.
Mrs. Ortiz,
Yes.
Dr. Katz,
Yes.
Cindy Gaffney,
Yes.
Mrs. Altoff,
Yes.
Dr. Zurich,
Yes.
Cecilia Carmen,
Yes.
and Joe Clark.
Yes. All those voted aye, and the motion passed. Item 6 on the agenda is a contract or a memorandum of understanding for the Youth Family Center. Does a member of staff wish to comment?
Lindsay, I think this one is yours, correct? VCCP?
Youth Family Center?
Mhm.
Yes.
Does anyone have any questions about this MOU?
This is pretty typical. This
Yes.
looks, I looked through it, it looks
Yeah, so
exactly
the
like.
MOUs all got updated with the state's attorney's office, so all the MOUs that will come forward now have the updated language.
Anything else out of the ordinary with this? No, cool. I'll make a,
Is there any monetary impact?
No.
No, okay.
I'll make a motion to approve.
Second.
the Youth and Family Center contract.
A motion has been made by Mr. Markison, second by Ms. Gaffney, to approve the Youth Family Center Memorandum of Understanding. All those in favor say aye.
Aye.
Opposed say nay. Ayes have it, motion passed. Next item is 6B. It's a open point of distribution memorandum of understanding. Staff member wish to comment?
Yep, so the next two are mine. As Melissa said, our closed pod and our open pod MOUs were very, very old, so it takes time to review them, change them dramatically. So we just need your approval, and then once it's approved by the board, we'll send them out to every partner on that list to get them re-signed.
Do you have a short version of what changed from the previous MOU to this?
He just changed the language. I don't have the exact, because he really just changed the whole thing. So I don't have a summary of exactly what the changes are. But he updated all the language, used what we use in almost all of our MOUs, and
But
A lot of legal stuff there.
you've looked through it and you're
Yeah,
comfortable.
we're good with it.
The state's attorney have to be comfortable with it too.
I assume, if they approved it, I assume, but I want to
I'm
make sure that
assuming.
the people that use it actually, yeah. I mean, I looked through it and I'm like, again, like you said, it looks pretty boilerplate to me, but.
Yeah,
It's no financial impact.
Right.
no.
So,
I'll make a motion to approve the memorandum of understanding with the Open Pod memorandum of understanding.
Second.
Can I do both?
let's do one at a time. Motion's been made by Mr. Murkison, second by Ms. Gaffney. All those in favor say aye.
Aye.
Opposed, say nay. Ayes have it, motion carried. 6C, close point of distribution memorandum of understanding. Same thing. Board member wish to make a motion.
Is it, just to clarify, the difference in open and closed is, it looks like the opens are schools and the closed are like private organizations and fire departments?
Yeah, so the open pods are like what we used in COVID, where anyone in the whole, like, we would run an open pod and anyone from the public can come to an open pod. So we do use schools, like really large
Mhm.
locations.
So when we did vaccinations of the
Yeah,
school?
so like an open
Got it.
pod, which means anybody can come get medication, vaccines, whatever we're distributing for the event. The closed pod is an agreement with a location where all we would do is supply them with the meds or the vaccine, and they do the distribution themselves to their own population. So like a long-term care would be their staff and their residents, the fire department would be their staff, things like that. So we just supply them, and then they handle everything moving forward, and then return the paperwork back to us.
Awesome.
And we do trainings for the open and closed pods regularly, so they're trained closed pods are trained every other year. And they come in so they understand what, their role is in that.
I'd like to make a motion to approve the closed pod distribution memorandum of understanding.
I'll second.
Did you
I have a question, but it had nothing to do with approval or anything.
Go
It just, the school districts here, are they ones that reach out to you, or how do they?
For the open pods?
Yes.
Those have been our open pods since after 9/11. So originally, we did reach out to them, and we tried to have schools that were in different locations in the county so that it wasn't just like centered in one location. And they've just continued these MOUs through the years, so.
Okay. There hasn't been any new school districts that reach out asking
No,
for?
not at this time, but we do try every so often. I think we feel like we have enough open pods right now if we needed to, if there was an event, but, and in different locations. But closed pods, we're always looking for new partners for closed pods.
Because there's nothing in McHenry.
I'm thinking more like Harvard.
And if Harvard School District wanted to become an open pod, we would definitely entertain that but I actually don't know if they've been contacted or not, but I can look into that.
Yeah, I like that. I like the Maringos on there. Maringos would never have their higher need community areas.
And
but
Johnsburg.
Johnsburg would be close to McHenry if there was anybody in there in that area. Because
Because
these are
far
open.
from Harvard's close to Maringo, you mean?
Right.
But
Okay.
again, if you have no transportation, it doesn't matter how close it is, right? You still can't get there.
And we do like to look at locations where there's, ingress, egress that are easy to move large amounts of people through, so.
Any further questions from the board?
Okay.
We have a motion that was made by Ms. Gaffney, seconded by Dr. Zurich. All those in favor say aye.
Aye.
Opposed, say nay. Ayes have it, motion passed. Next item. You have to bear with me because I'm going to read this. It's a resolution. Resolution authorizing the county to enter into a contract with National Business Furniture for the purpose of furnishings for the Crystal Lake renovation project, item 51 in the budget. Whereas the approved Crystal Lake renovation project included furniture, fixtures, and equipment, and whereas it has been determined that additional furniture is needed to optimize workstations within the redesigned and reconfigured space, and whereas a portion of the cost, including delivery and installation, are outside of the original bid for the project, and whereas National Business Furniture was awarded Equalis cooperative contract number 2024-0101, which meets or exceeds the competitive procurement requirements for the county, and whereas the estimated $135,000 expenditure for this project is included in fiscal year 25 budgeted line items 60300-60-90-9000-221, furniture and fixtures greater than $5,000 under the ARPA funds, and 60300-60-51-5111-100, furniture and fixtures greater than $5,000 under the SIPA grant. And whereas the resolution has been reviewed by the Public Health and Community Services and Finance and Audit Committees and the Board of Health, and is being recommended to the McHenry County Board. Now therefore be it resolved that the Director of Procurement and Special Services is authorized to enter into a contract with National Business Furniture in the amount not to exceed $135,000. And be it further resolved that the county clerk is hereby authorized to distribute a certified copy of the resolution to the Chief Financial Officer, County Auditor, County Administrator, Director of Procurement and Special Services, Director of Facilities Management, and the Public Health Administrator, dated Woodstock, Illinois, this 21st day of October, AD 2025. That would be the date that the county board passes it. So we were asking the board to, recommending to the board, county board, to approve the resolution. Any board member wish to be recognized? Barb?
Sure. I will move to approve the resolution or send it on to the county board.
Correct.
I'll second that.
It was Dr. Cass, right?
No.
Oh,
Me.
Sorry.
Sorry.
Sorry. Okay, motion's been made by Dr. Amsler, seconded by Ms. Altoff. Any comments or questions from the board? Is it as a monetary issue? We'll do a roll call vote, please.
Okay. Dr. Amsler?
Yes.
Ms. Altoff?
Yes.
Ms. Ortiz?
Yes.
Ms. Gaffney?
Yes.
Ms. Lawson?
Yes.
Ms. Carmen?
Yes.
Dr. Katz?
Yes.
Mr. Marcuson?
Yes.
Dr. Zurich?
Yes.
Dr. McGuire?
Yes.
And Mr. Clark?
Yes. All in favor, motion passed. Next item, 7B. Amendment to Section 2.6 of the McHenry County Department of Health Personnel Policy. And I will defer to the chairperson for the Personnel Committee.
Thank you, sir. So personnel met on this past Wednesday to discuss changes to the Section 2.6, which has to do with in the personnel policy in regards to vaccinations and TB requirements for the employees of the health department. So after a discussion, we settled on some updated language. And the primary reason for that is that with the shifting winds, we'll say, federally and state-wise, referencing, the previous document referenced just the CDC. So now that we see that the state is taking more of a forward step in this regard, we want to make sure that the recommendations in regards to how to best protect our staff and the public who interacts with our staff is done from a position where we take into account the recommendations from both of those organizations, and also took an opportunity to incorporate our medical director as well. So I have some updated language. I'll just read it to you. There's a red line that's part of your copy, but I'll just give you the short version here. This is actually I wouldn't say a lengthy document, but it's a couple pages. And the changes we made were pretty small. But this is in paragraph 2. I'm just going to skip down part of the ways, and it says, the Department of Health, and this is the updated text, the Department of Health, in consultation with the medical director, will annually review the guidance and recommendations from the Illinois Department of Public Health and the Centers for Disease Control and Prevention, and make recommendations on requirements to the Board of Health for employee vaccinations and TB screening. The recommendations will prioritize the highest standard of care in disease prevention and control. And then down a little bit farther, there's just one little change. That changes CDC recommended boosters to the annual vaccine, right? And that, all this is just helping to streamline the idea that as needed, the information will be reviewed, and with the assistance of our medical director and you know, as a group, we can help determine what is the best course of action. Very straightforward. Anything else you'd like? Anything?
No, I
to add?
think you did a great job.
Okay. So that was the language we settled on the Personnel Committee. That's what we recommend to this Board of Health to approve. And
That's your motion.
yes, I have that would be my motion, to accept the languages I've just explained to you all.
I will second.
Kirby.
I was getting ready to read the book in true Kyle form.
I'll do it. Don't make me.
A motion has been made by Mr. Markison, seconded by Dr. Katz, to approve the amendment to section 2.6 of the McHenry County Department of Health Personnel Policy. Any discussion from the board? Hearing seeing none, I will do a voice vote on this. All those in favor say aye.
Aye.
Opposed say nay. Ayes have it, motion passed. Item 8, board issues. Any member of the board that wish to speak on any topic? No, not tonight?
I just would like to say again, I'm grateful to Director Noem and Administrator Adamson for and other members of your staff, I apologize, who helped make Mr. Lovato's memorial was a great event, and well spoken by our board president, and it was great. Little stories and things by family. It was really nice. So thank you for doing all that.
And also thank you to the other members of county staff that procured the tree, got the tree planted, got the memorial stone created. It's a very nice tribute to Jeff Lovato. It's for those of you that want to take a look at it during the daylight hours sometime. It's on the east end of the building, out in the grass area. It's a nice healthy tree that will grow for years and will be a remarkable tribute. And I do feel that it made an impact on the family. It helped give them comfort and some closure. So yes, good job to all. Anybody else on this weekend on anything?
I will share my gratitude for an opportunity where I got to hear Melissa speak and represent the health department and all of the really amazing work that you're doing here. It was 15 minutes of rapid fire that she did 4 times, and it was really awesome to hear people who perhaps didn't know much about what happens here learn and ask questions about the impact of globally what is happening with public health and how it impacts our community. So I was proud to be there to listen to you.
Thank you. Good job.
Where was this at?
It was an alumni event for leadership of Greater McHenry County.
Oh, okay.
And she represented all of healthcare in the county.
I didn't speak
Well-
out of my school.
She was the representative.
Table.
She was the representative who was called to speak about healthcare as it pertains to the work that is done here.
Was it Friday morning?
It was last Thursday morning.
Because Franny was saying that.
Yep, she was there. Yeah.
Yeah,
Oh,
I saw her
thanks.
Friday.
Can you look at that?
Yeah.
Items 9 and 10 on the agenda are the information communications and appendix. That's included in your board packet. Some very useful information. Please take time to read it. And there is no need for executive session. So,
I'll make a motion to adjourn.
I'll second that.
who's second? Who was second?
I did.
Okay. Motion's been made by Mr. Markison, seconded by Ms. Altoff to adjourn. All those in favor say aye. Opposed say nay. Ayes have it. We are adjourned at 7:11.
Oh my gosh.
Mike,
This is,
that's good.
I'm on this board.
It's not quite the record one, so we're close.
Wait, what's the record?
I think the record was 25.
Well, there was one time we did